Good morning, everybody. Let's see if I got this right. Here we go. So my name is Ben Struck. We're about to start the webinar here. I'm the FAA Safety Team Program Manager, and I'm going to try to show you my webcam just for a second here. So that's me. We have Don and Dr. Panzer with us as well. We also have in the background Ken Krantz and Rick Ryan from Mid-Island Air Service, and we know Don. If for some reason during this webinar we lose internet connectivity or the system crashes, check your email, the one you use to register for this GoToWebinar, and we will send instructions there. Sometimes it's a minor short outage, sometimes it's something that's longer, and we need to send you an email telling you we've rescheduled or delayed the presentation. So right now I am talking. Everybody should be able to hear me. You should be able to hear me through this entire slide deck. If for some reason your audio is not working, the Citrix GoToWebinar audio over your computer tends to work better in Google Chrome versus Microsoft Internet Explorer, or you have the option to listen via telephone. So what you should see right now on your screen is the slide deck where I've got a presentation that says what you should see. And on the right-hand side of your screen, normally there'll be a control panel. If you go to the audio pane, they call them, those little windows, audio pane, you should have the option to toggle between your telephone or your mic and speakers on the computer. If for some reason, when you're not using that control panel, it minimizes itself automatically, just click the orange or red arrow, depending on your color perception, and it will make that window bigger for you to be able to interact with the panel. If you need to join via mic and speakers, you just click mic and speakers. If you're going to choose the telephone option, there'll be a dial-in information available to you either when you join the webinar in the original email, or I believe when you click that telephone or phone button, it will provide you additional information on how to dial in. And Ken and Rick in the background can assist you with problems. You can use the question panel, which we'll show you here in a minute. Throughout today's webinar, we will have a couple of handouts. And so in your control panel on the right-hand side should be a handout section, or if you're on a mobile or iPad device, I believe there's a section, looks like a little document. You click that and that'll show you the handouts that we will reference throughout the presentation. We're not going to, you're going to have the ability to raise your hand, but we're not really going to acknowledge raised hands right now, but we will use the question panel to ask questions of the staff, and we will collate those, collate and bring them up when it's pertinent during Dr. Panzer's discussion, and then we'll have questions throughout the presentation as well as questions at the very end for everybody to ask questions. So please just type your question in there. Hopefully, if it's something easy that one of our panelists can answer quickly, they will. Otherwise, we'll elevate it and we'll bring it up via voice later. You have the ability to take a screenshot of your screen if for some reason there's an informational screen that you want to capture. Many browsers will allow you to do that, usually via a print screen method or maybe some other method on your computer. But we have the ability here as well during the webinar. If you've clicked the panel to show what slide we're showing, you can take a screenshot. Right at the top of that panel, there's a screenshot button, looks like a camera, and you have the ability to save that to your computer. What I'm going to do, we're going to do this more towards the beginning of the presentation, but I'm going to test right now our polling functionality, both to get you engaged and because we're interested in actually having some of these questions answered. So we're going to ask the first question here, and it has mostly to do with, as you know, Don at Mid-Island has done a great job of having monthly seminars. Well, because of COVID-19. Obviously, we're not meeting in person, and so we've transitioned to this webinar format. So we want to know if you're a regular attendee, in-person attendee to the Mid-Island seminar. So I'm going to launch a poll. It'll come up on your screen. You have the ability to select it either by touchscreen if you're on a mobile device or via computer mouse, and you'll select one of the following. Easy choice. Are you a regular in-person attendee to the Mid-Island Air Service Seminar? Yes or no? I'm going to leave the poll open for, we have about 79% voted, so we're open for about 20 seconds now, and I'm going to close the poll now in 3, 2, 1. I'm going to close the poll, and then I'll share the results so we can all see them for this particular question. And so we see that, very interesting, 71% of us are not regular attendees to the in-person. So that's a good good data point for you, Don. So I'm going to go back to hiding that. I'm going to move on here to the next slide. Wings and/or AMT credit. In this case, it will be Wings credit. I believe we've given you 2 advanced Wings credit. So Wings credit is based on your attendance, you're here right now, as well as your attentiveness. So at the end of this webinar, we get a report that'll tell us for all the users what kind of metrics did they have. Were they paying attention? Were they engaged? Or did they log off after 3 minutes because we bored them? So if you're attentive for a majority of the time and stay with us, you will get credit issued. It'll be issued via FAAsafety.gov, and it will come to the email address associated with your FAAsafety.gov account. So if for some reason you've registered for the webinar with a different email address, just put a question in the question panel and just say FAA Safety account and put your new email address so that we can make sure to reconcile that when we give you credit. Credits normally take about 3 business days to appear in your account, so give us a few days before you bug us and say I never got credit. But if for some reason, about a week or so you haven't received credit, certainly reach out to Don or myself and we'll help you with that. All right, next I'm going to introduce Don Lawrence. Don Lawrence from Mid-Island Air Service has been instrumental in trying to get this transitioned over from in-person seminar to webinar, and he'll have some great words for you. So take it away, Don.
Good morning, everybody, and welcome to Mid-Island Air Service, our monthly safety seminars. As you know, Ben said, my name is Don. I'm going to just talk briefly a little bit about just a welcome, the venue change, sponsors, today's topics, and speaker introduction. Ben, can you flip forward one more? Oh, no, right there. Okay, no, you're good. You're good. I'm sorry. So anyway, welcome everybody to our monthly seminars. We do these on the second Saturday of every month. They're obviously given by Mid-Island and in conjunction with the FAA. First, I just want to say we hope you and your families are all doing well, and hope everyone is maintaining our social distancing. This is what's going to help us get through all this. And given all that distancing, it's not a good time of the year given all the holidays. So I hope everybody is managing with Passover and Easter, and you have good holidays. We're living in a very difficult time, especially in aviation. Very hard to maintain social distancing in the cockpit, but and all of us are unsure of what's next. But one thing is for sure, this will end. We just want to be ready for what might be a new world for us. Mid-Island is a full-based operator. We're located at MacArthur Airport in Islip. Our designation is ISP. We're a flight school. We do rentals, fuel, sales. We have corporate services, AMP services. We've been doing one of the things I've been doing for almost the last 17 years. We've been doing these seminars. So it started in December of 2003. This is actually our 183rd seminar that we're putting on, and only 3 cancellations in all that time. One a snowstorm, one a death in the family of one of the speakers, and then last month we had to cancel our seminar last month. So You can see from the picture on the side, this is for those of you that aren't regular attendees. We usually hold this in we have a big hangar we clear out, and we hold it in the hangar. We have somewhere around 80 or 90 participants each month. And so it's hopefully we'll get back to this. So venue change. This is, obviously this is a new way for us to do things, so we're learning, and we want to help us stay in touch with what we love, and that's flying. We're doing a lot of video conferencing, and as you know today, GoToWebinar, which we're doing with thanks to Ben with the FAA. He's done a great job in getting us organized in this. We have, I've actually scheduled with Ben the next 3-4 months. We actually have the first half of the year already scheduled. So, and I'll tell you about what's coming on later. But in addition to these seminars, we are using Zoom, and we've got a bunch of different meetings set up. We have clinics and ground schools. Normally, just so anybody knows, we are doing ground schools. Our CFIs are doing them like one-on-one sessions with students. So if you don't have a CFI, or you have your CFI and you'd like to do a ground school, let us know. You can always, for any questions, you can always send me an email, don@midislandair.com. My email is at the bottom of each of these slides. But for any ground schools during this crisis, we're at least a 30% discount rate, so that'll be helpful. And we started clinics a few weeks ago, and they're 1 hour. We're doing them on Wednesdays at 1 o'clock. We're going to charge $15 for an hour ground school. We've done topics on non-towered airfields. We've done ADMs. We're going to talk about hypoxia next week, and then the week after, we're going to talk about ATC and ground and communications. So if you're interested, you can find information about these either on my emails or on our webpage. We'll post all this. We also are doing meetings with our employees just to keep them in touch and what's going on. We've also been, we're going to resurrect our VMC meetings that we're going to do. They're probably going to be doing on the 3rd Thursday and at noontime. And we put up a scenario and talk about it, all very professionally done, and they're really pretty good. We just talked about our seminars. We'll post all of this on Facebook. And again, any questions you can mention to me. In addition, I'm just going to mention we do camps in the summer. Now, we don't know what's going to happen given all of this, whether we're going to be able to do the camps or not, but I'm just letting everybody know we are still taking reservations. So at least we know if we're a go, we know who's attending, and if not, we obviously will do a refund or reschedule, or we'll do something. But more information you can find, we'll post on our website. And just bear in mind with us, please, it's all new to us. We're going to make mistakes. Things are going to go wrong. But, and we'd really we'll give a chance for your feedback at the end. And we'll talk more about that at the end. We'd really like your feedback on how this is going. So let's get started. What I'd like to, Ben, there you go. Okay, I'd like to offer you a virtual cup of coffee and a donut. David, there's your donut. So usually what we do, the seminars have always been free. We always serve coffee, donuts, bagels, muffins. So unfortunately, I can't help you today, but it's a thought that counts, right? Nope, wrong way. Sponsors. There you go. Okay. These seminars, we've been able to keep these going and keep them for free because of our sponsors. So if you would like to help us in any way, you can email me. We have different levels of sponsorship. Our two main sponsors are here, Dr. Arnold Panzer. Dr. Panzer is the one actually giving the presentation today. I'll talk a little bit more about his credentials and all that in a couple minutes. And also John Nelson, who anybody who attends knows John. He supported us these seminars for a year as the doorologist. He's since gotten out of that business. Now he's in pilot to pilot. And this is an awesome website that he's put up. And I encourage everybody to go on it, take a look. It's a way to share, particularly right now. It's going to be very difficult, but and we all know how expensive flying is. So if you look at his site, anybody that's a member can post a flight. Other pilots that are interested can take a look, can search for a flight they'd like to do. The two pilots kind of meet offline. If they want to fly together, you arrange it, off you go, flying costs. And there is a handout that you can print on that. Ben, next slide, please. Also, what we do is for each seminar, we put out information on our sponsors. They support us, so we encourage everybody to try to support them. There's a wall sponsor where we put everybody's business cards out, and you can also, if you see down in the corner, there's a green table that's actually there. Not a very good picture, but sponsors get to put out their brochures, their information. So it's a good way to do it, and we appreciate all the support on this. And again, if you're interested, email me. The one thing I did want to mention is that we've always done a 50-50 during the thing, where the money goes to a charity that Mid-Island has set up, the Lou Mancuso Scholarship Fund, and we give out two we give out two awards to two high school students that are graduating and pursuing a career in aviation. So it's for a good purpose. And if there's information on our website, if you'd like to contribute and help us out, that would be fine. Just go to midislandair.com and there's information there. And we'll put information out on our Facebook page as well. Today's topic, we're going to talk about FAA medicals, how to stop worrying and like your AME. Dr. Panzer is going to talk about your medical regulations, maladies, some health issues, questions and answers. Also, I want to mention that the next 3 months are set up. Next month, Pod Boomers, Ken Krantz, who's also on the conference today. Ken has spoken at, done several seminars in the past. He's helps us with our camps. He's a sponsor of the seminars as well, and we appreciate it. And that's going to be a great one, particularly now that we're all relegated to staying home. I think this will be really interesting. In June, again, second Saturday, David Windmiller, acrobatic pilot. He's also done several, also a sponsor of Mid-Island. He's going to talk about landings. Originally, we were going to, and we still might, we don't know yet, do a contest. And if we can figure out some way to do it, we've been trying to coordinate with the Pilot Club, the Mid-Island Pilot Club, and they are going to sponsor, along with Mid-Island, a contest. If we can figure out some way to do it, we'll do it. You can email me about it, or Dave Tabachnik. I can send you his information. He's the president of the Pilot Club, which they also meet on the third Monday of each month. I can get you information for that if you're interested in doing it. They're going to do it as a virtual conference also this month. And then in July, we're going to talk about small unmanned aircraft systems again. Hal Stanloff, and Hal is a good supporter of Mid-Island and helps us a lot with our camps. So we appreciate all of this. So we'll get going. Our speaker today, Dr. Arnold Panzer. Dr. Panzer, he's AME, and he'll talk about your medical. I just managed to get my medical at the beginning of April or beginning of March before we even knew all this was happening, so I kind of squeaked in. He also has another company called Land, Sea, and Air, and a medical review specialist. He does drug testing, occupational medicine, and that for FAA exams. He's a senior aviation medical examiner, certified medical review officer, a certified examiner for the Federal Motor Carrier Safety Administration, and he's associated with the New York University School of Medicine, Internal Medicine, and Brown University School of Medicine, Dermatology. He's a private pilot, instrument rated, commercial helicopter. And this is where we normally, I would say, let's give our Dr. Arnold Panzer a good mid-island welcome, but just think about 300 people all clapping. So welcome, Dr. Panzer. Thank you, everybody.
Okay, good morning, everybody. So I'm Arnie Panzer. Thank you for that introduction, Don. So here we are today. I've been a senior aviation medical examiner since 1987, so I have a bit of experience. But today, on today's lecture, what I'd like to do is to give you an overview and make you feel a little bit more comfortable about your exam when you go to the AME, as well as I'd like to give you an idea that if you do have some medical problems, you'll be able to better approach your AME and your exam when you go to the AME. At the same time, I would like to go over some topics that are pertinent to you as an aviator, certain things like over-the-counter medications, opiates, and the aging process that we all experience as aviators. So I'm gonna turn this camera off for now, and we're gonna go to some questions. Okay, Ben?
Yep, so I'm pulling up some polls that we have here. We're gonna ask some basic questions here. First, some demographic stuff, if you don't mind. We're gonna launch a poll here for, we wanna know where you're coming from. Where are you joining us from to attend this virtual meeting? New York, New Jersey, Connecticut, New England, Mid-Atlantic. We took some loose liberal definitions here on that, or other, Southeastern or other. And so we've been open about 20. We're going to close it in 3, 2, 1. Close that. And I will share that just so everybody can see. So a majority of us do come from the New York, New Jersey, Connecticut area, followed closely by the Mid-Atlantic region. We're going to go to the next poll here. We're going to hide that one. In which age bracket would you identify? Now, this is totally anonymous. We're not collecting this data for any other purpose other than just to see what kind of audience do we gather for something like this. So very quickly, we'll leave this one open. It's we got 80% voted. We'll close it in 3, 2, 1. And I'll show you those. So a majority of us in the 50 to 75 range. Interesting. We have one left. All right, we'll hide that one. We got another couple here, and then we'll get into some medical related questions. What class of medical do you normally seek? And we gave you options for first, second, third, none because you use basic med, or none, you don't seek a medical at all. And again, these are anonymous, they're not tied to any one account. So don't feel like there's any danger in these answers going anywhere other than just give us a sense of who our audience is for our discussion today. All right, polls closing in 3, 2, 1. And we'll show you those. So a majority are about 42% third class, followed by second class. Only about 18% using basic med at this point. Interesting. Moving on to the next one. I'm going to skip the coronavirus related question. I'm going to go to some other medical questions, if that's all right, Dr. Panzer. So here's some questions to give Dr. Panzer some insight into what your knowledge level is. So I was diagnosed with sleep apnea. I use a CPAP machine. I'll never be able to fly. I'm not going to tell my AME. Is that right or wrong? About 50% voted. Closing in on 85%. Great responses here, and closing in 3, 2, 1. And I'll show you those. And so now, Dr. Panzer, majority of our audience here, 96% of them said that was wrong. Would you agree with their assessment?
Yeah, that's correct. Okay, there's a whole host of different types of sleep disorders that we see in our field, but sleep apnea is probably one of the biggest sleep disorders. And you can fly with sleep apnea as long as you're appropriately treated, whether it would be would you have a device or would you use a CPAP machine. So we have people that come in and they tell us they have sleep apnea and they're on the CPAP machine. We can actually issue at that point, but they're going to need to follow up with the FAA. The FAA, in certain circumstances, will give that aviator 90 days to get their information regarding their CPAP and their status for their sleep order to the FAA region. And they'll issue probably a special issuance. So every time they go for their medical, they'll have to present some type of data regarding their CPAP compliance, as well as a letter from their doctor to state that they're doing well with their sleep disorder.
Great. I'm going to hide that question. We'll come up with the next medical related question. And I'm going to launch it now. I have restless leg syndrome, which is controlled with quinine tablets. Can I fly? Yes or no? You could see we made the questions, or at least the answer portion, fairly easy. We didn't want you to have to think too hard this early in the morning. So we're coming up on about 70% voted, 75, and I'll say I'm going to close the poll in 3, 2, 1, and I'll share the results. So about 80% said, yes, I can fly. What do you say to that, Dr. Panzer?
Yes, you can fly, but probably depending upon your situation, we may have to get guidance from region, and it may have to be that we issue either a special issuance or an AME assisted special issuance. So the FAA may want to have additional information when you come in for your medical certification. So we always go to region for guidance for this. So it's possible you may have to go through an AME assisted special issuance.
Okay, great, thank you. Go to the next one here. I just started using CBD oil for my allergies and I feel great. Can I fly? Yes or no? And we have one of our attendees here, Carl. Thank you for that comment to say, hey, we need a don't know answer. So moving forward, I think if we do these again, we will certainly offer that as an option to show the honesty. And so we're going to close the poll here in 3, 2, 1. And I will share the response. 76% say we should not be flying if we've been taking some CBD oil. What say you, Dr. Panzer?
Okay, so CBD is cannabidiol, and it's a non-hallucinogenic piece or metabolite of marijuana, essentially. And you can see that it's over the counter, and it's been used for many medicinal reasons. However, it can be contaminated with the hallucinogenic portion of marijuana. So for that reason, we don't accept this as a drug or a medication that you can fly with. So you cannot fly if you are taking CBD.
Great, thank you. All right, next question. I just had lidocaine injections into my spine for a back condition. I feel great. I'm planning to fly tomorrow. Can I fly? This is the easy yes or no, or I guess the don't know answer. So we have about 70% voted right now. Close the poll in 3, 2, 1, and we'll share those responses. So about 71% say we shouldn't be flying if we had our lidocaine injections. What does the FAA say about that?
That's correct. First of all, we want to know what if you're having lidocaine injections for pain, so you must have a fairly significant back disorder. So we question whether the back disorder itself could be disabling and affect you, and that would fall under the 6153. So that's the portion of the FARs where, do you have a condition that could possibly, you may have you have your medical certification, but do you have a condition that, even though you have your medical certificate, can this be disabling in the cockpit? Okay. However, you're also being injected with lidocaine, which is a drug. So not that usually a locally injected lidocaine is a local anesthetic, very few side effects. But I think more so that the condition is requiring these injections. So the FAA, as an AME, we would want guidance from the region, and more than likely you would have to, if you got these on an ongoing basis, you would have to have an AME assisted special issuance. So to keep us updated, they would want some documentation what's going on with this on your next medical.
Great. I'll hide that one. I think we have one more related to this. I was prescribed medical marijuana from my doctor for a medical condition. It was written for me after my last third class. Can I fly? Yes or no? So medical marijuana from a doctor after my last third class. About 80% voted right now. We'll close the poll now in 3, 2, 1. And showing the responses.
Okay, so that's correct. Medical marijuana, it really doesn't, even though you're taking it for medicinal purposes, again, there's no hallucinogenic effect on medical marijuana, but still the FAA does not allow medical marijuana. It's a Schedule I drug. Even though it is prescribed, they still will not allow it for a pilot to take it as a pilot. So no, you would not be able to fly with medical marijuana.
Great, thank you. So I'm going to turn it back over to you. Let's see if I can get the slides to go ahead. I think I did that. So now I want to share my screen again. Stand by, everybody. Let's see if we get this right. Here we go. All right, I think Dr. Panzer, I think we're back on track here. Okay, so these are some of the topics we're going to be covering today. I'd rather, even though we're going to be covering the regulations, I really want to zero in on some of the medical conditions so you get a feel for where you stand. So we really want you to get a feel for that you're going to the AME, you've got a good feel for your medical conditions, you're presenting to the AME. It will make his job a lot easier, and it'll also keep you better informed how your medical conditions interact with your certification process. At the same time today, we're going to, as I said, we're going to be talking about certain topics, over-the-counter medications, the aging pilot, and at the end, we'll also touch on COVID-19. So we can go to the first slide, Ben. Okay, so I've been a senior aviation medical examiner since 1987, so I have a fair bit of experience. So naturally, pilots are really adverse to going to their AME, but it's really not it should not be a
conflicting situation where the pilot feels ill at ease because they feel that the AME is going to look for things to not deny their medical certification. That's not the case. We try to work with you. We try to work with you and the region to get your certificate and get you flying. So that anxiety that you have sometimes will make you say things or do things or omit things that are really inappropriate and detrimental to your health as well as the certification process. So you really should feel that the AME is trying to work with you to get your certification as easily as possible and with as little pain as possible. Next slide, Don. Any questions regarding our position as well as the AME's position? Any questions, Ben?
So we're looking for Don. Don, have you been able to determine if there are any questions relevant to this first topic?
Well, I have 3 questions here. I'm not. Let's just. I'll read them. I'll read them to you. Hang on 2 seconds. Michael asked, what is the difference in regards to bringing up sleep apnea if you are a commercial ATP pilot versus a GA pilot?
There's no real difference. Again, with first class or third class, the problem of any sleep-related disorder, the FAA aeromedical certification, they approach the problem of any sleep disorder the same whether you're a first class airman or a second class airman. So you still have to present with the same information to the AME so you can get your certificate.
Okay, good. So Oz asked, does TURP, T-U-R-P, procedure, urinary tract, impose any difficulty for an AME to approve a third-class medical certificate?
Well, that's a procedure. That's an operation. So usually, if it's uncomplicated, you should be able to get your and you've had a good convalescence and you're back to your normal self. Usually that shouldn't be a problem, but sometimes depending upon your other medical problems, I would go to region and get some guidance. But I would say more often than not after a TURP and you're well incorporated into your normal everyday life and with no complications, we could probably issue without any type of special issuance.
Okay. And we have another question from Ray. 2020, with the aging process, should I go to the eye doctor first before going to an AME appointment?
Well, are you saying that if you're saying that your vision is in 2020, or you have problems with your vision, it's a good idea to go to your ophthalmologist or an optometrist first. But if it's minor, if you have to be willing to accept that if it's a minor change in your vision and you usually have no limitation in terms of wearing glasses, you may be, and you're not wearing glasses at the present time, but you noted deterioration. And if we pick up that your vision doesn't qualify, that'll hold things up and you'll have to get glasses and come back and pass the test. Usually if you come, what happens is if you come in and you usually 2020 and you usually get no limitations and we find out that your vision is worse than 2040, we have 14 days to hold, as AME, we have 14 days to hold your medical, so you can go to the store, go to the optometrist, ophthalmologist, get your vision corrected, come back with glasses, Within 14 days, we'll check your vision. You pass. You'll have the limitation, must wear corrective lenses, and you'll get your certification from the AME. So it's a little bit more work on your part. We can hold it for 14 days and for that particular situation, but it's probably best if you detect some disturbance in your vision, go to the optometrist, ophthalmologist first, and get your glasses and come to us.
Okay, and I have one more, and then we can start proceeding. Stephen asked, high blood pressure and propranolol for treatment. Is that okay? Did I pronounce it right?
Yes.
Okay.
Okay. Propranolol is accepted. It's not one of the ideal drugs for blood pressure, but beta blockers, I believe we will allow that drug. That is a condition that's called a catchy condition. That's called a condition that AME can issue. So you should have a statement from your doctor that you have no side effects, no slowing of the heart rate, no problems with the propranolol, and you could be issued by the AME.
Okay, Dr. Panzer, I think that's all we have for this segment, then we can continue.
Okay, so we can go to the second slide. Okay, so part 14, CFR 67, this is the part of the certification where it defines what medical conditions you cannot have to get your class 1, class 2, or class 3 medicals. On the CFR 6153 assumes that if you do have a medical, they give conditions, or just they more or less open it up to any condition that may affect your ability to fly, whether it be a medical condition or a medication. You would have to ground yourself and go for recertification because of that condition. So the 67 gives you the standards to get your medical, what medical conditions you should not have, and they also state what conditions are outright we'd have to deny initially, and then you'd have to apply for special issuance. But 6153 is a blanket statement saying that if you have any medical condition that may affect your condition, your ability to fly, no matter what your medical certificate is, you should not be flying. Next slide. Well, let's go to any questions regarding that. By the way, 6153 would be applicable to basic med and to sport pilot and recreational pilot. So even though a sport pilot and a basic med require a driver's license to fly, you still have to be aware that certain medical conditions can affect your ability to fly, and that will affect whether you should be flying or not. And so you have to be aware of that.
Okay, can you hear me, Dr. Panzer?
Yes.
Yes, okay. Yeah, we have a question from Fred. What's the status of questions about sleep apnea as part of the exam? Is there any difference between a third class and a basic med exam?
Interestingly, sleep apnea is one of the conditions. You can have sleep apnea, and it's not going to be. Don't forget, you're being examined for basic med by a regular doctor. Sleep apnea is not one of the conditions, no matter what type of sleep apnea you have, that will automatically deny your medical. Your private doctor really needs to know have some idea that sleep apnea can affect your ability to fly. So it's kind of vague for him. He has to use his judgment whether sleep apnea can affect your ability to fly. At the same time, there's no absolute negation of your medical because you have sleep apnea, because of your basic med because you have sleep apnea. So it's one of the conditions you can have and not have to provide any additional information depending upon your private doctor. There's only a few conditions that would hold up your basic med from a regulation standpoint. So if you have any neurological problems, any psychiatric problems, or any cardiovascular problems, before you get your basic med, you would have to get a special issuance for any one of those three, and get a regular medical certificate, first, second, or third, and then apply for basic med. But sleep apnea, no, you can get by without any investigation with sleep apnea, depending upon your doctor. I'm not sure if that makes it clear.
Okay, we have another one here regarding the normal aging hearing loss. This is from Ray. I have been diagnosed with some minor hearing loss, but I have no problem hearing normal conversation. How will this affect with seeking first-class medical?
During the first-class medical, we're required to examine you for regular conversational speech. So in the normal course of conversation during my examination, we have a good dialogue and you can hear my questions with my back towards you, which I usually do, you pass. So as long as you pass conversational speech in a normal environment, you will pass.
Okay, Maurice, can you move from basic med to third class?
Sure, you could do that, but you'd have to take a regular third-class medical. Having basic med is really not going to make you have any advantage to getting a third class. You still have to pass the standards for third class.
Okay, from JJ, ibuprofen. One of us has a prescription high dose problem. It was with a question mark. It says ibuprofen. One of us has a prescription high dose. Oh, is it a problem? I guess. Thanks.
No, it's not. But we'd want to know why you're taking such high dose ibuprofen. If you're taking it for a back problem, then we'd have to investigate the back problem. So the fact that the medication itself is not an issue. It's the issue is what the condition what is the condition that you have that requires such a high dose of ibuprofen.
Okay. And from Gerald, Dr. Panzer, do you perform physical exams for basic med?
Yes, I do.
Okay. Let's see here. Well, the questions keep on coming. Okay, so from Michael, does the AME work for the FAA or the patient?
For the patient, but we don't forget we're appointed by the FAA, so we're an extension of the FAA, of the Aeromedical Division. So we have to abide by the regulations 67 and 6153. So we're extension of the FAA, so we still have to work for you within the realm of the guideline for certification. So if you don't, and this is where the AME can go further in the process. So if we see that you have a condition that may be potentially worthy of deferral or denial, we'll work with you to get the data together to go through that, whatever process is required by the FAA. So even though we have a more or less a doctor-patient relationship, we really represent the FAA, so we still have certain guidelines we have to stay within.
Okay, from Harold, what are the requirements when you only have vision in one eye?
Okay, so usually if the vision in one eye is stable, it's not progressive, you would be probably eligible for a SOTA, which is a statement of demonstrated ability. So you would, if this is a condition that if you're starting to fly and you have this problem, you would come in for examination and we would defer the exam. We would complete the exam, defer the disposition of the exam to the Aeromedical Certification Division, and they would probably suggest, and you would probably request a statement of demonstrated ability. So that would probably require a possible flight test to see if you can perform the duties of within your certification you're applying for, and chances are you could get a SOTA, statement of demonstrated ability.
Okay, from Petro, my eye doctor says I see 20/20, yet my AME using an old piece of equipment says that I am not. What do I do?
What does he say? Well, the first question I would have is, what is the vision? Don, can you repeat that question, please?
Sure. My eye doctor says I see 20/20, yet my AME using an old piece of equipment says that I am not. What?
Well, I would, okay, good. So what I would do is get a statement from your doctor stating your vision, and myself, that would probably, the FAA wouldn't want to hear that because they'd want you to have, they would want the AME to have up-to-date equipment, to have testing that would be comparable to your doctor's visual testing. So that there's a problem there, but in those circumstances, I think the vision from your specialist noted on his and signed by him would probably be more worthy of true vision, but that's a difficult situation because that shouldn't be happening. The AME should have some comparable visual testing to the specialist visual testing.
Okay. I need to get back. We have 7 more questions, so I don't know if you want to, how you want to.
Let's take one more, then we'll go forward.
Okay. I'm just going to take these in order. Harold asked, does peripheral neuropathy affect an aviation medical?
Yes, yeah, it can. You'd have to, myself, if these are one of the things where we would look to the region for guidance, but more than likely, region would want some more information about the neuropathy, what's the underlying medical condition, what the treatment is, and how it could possibly affect your ability in the cockpit. So more than likely, that would be what we call an AME-assisted special issuance.
Okay. Well, we still have 6 more questions. We can hold them for later.
So why don't we hold them to last, and let's go to the next slide.
Okay.
So we more or less touched upon some of these points of the power of the AME and what the disposition of the pilot would be. So as an AME, we have several choices. We can pass you if we feel you're medically qualified. we can deny you if you have one of those several conditions, which we'll go through in a few minutes. And then we could defer you. So if we see that you have a condition that could possibly be a condition that could be denying, a denying type of condition, rather than deny outright, we can defer and let the region or Oklahoma City decide what the disposition is. So, for example, we'll get into some of those examples, but the AME has within its ability to either deny or defer, which are more or less the same thing. When we deny, it would create more difficulties for the airmen and more paperwork. Deferring for the same condition that may affect the ability to fly is easier for the airmen because it would speed up the process to get you back flying with that condition. A SOTA, we discussed a statement of demonstrated ability. A CACHI is a condition that an AME can issue. We'll get into those in the next few slides. Can we go to the next slide? Any questions regarding those dispositions?
I'm not seeing any.
Okay, so conditions that right off the bat, we see somebody coming with these conditions, anything from angina to bipolar disorder, coronary artery disease, diabetes. Diabetes, we recently, the insulin-dependent diabetic has the ability to fly now with certain stipulations. So that was recently passed. Up to this point, insulin diabetes was considered a denying type of condition with really no hope of getting the medical. But now, with the recent changes, the diabetic can fly if he is insulin dependent for first, second, and third. But there's a stringent protocol that they would have to follow, but it's possible you can fly and get your medical certification. Loss of consciousness for any unknown reason, epilepsy, heart replacement. So these are conditions that we would have to deny. So if we denied them and they went to Oklahoma City, you would have, Oklahoma City is going to take it as the case is closed. So you would have to apply to the certification division or possibly even the federal air surgeon to go through a special issuance process. So it would be a little bit more tedious for you. So I rarely deny if somebody comes in for these conditions. I'd rather defer, because when you defer, the Oklahoma City or the region will initially deny, but in the same breath, they will give you a possibility for special issuance under certain stipulations. If you provide them with certain data and treatment protocols, it's possible that with any of these initially denying conditions, can we go to the next slide to show additional denied conditions? So again, with these other issues that are initially denying, you can go through this special issuance process, which the region or Oklahoma City will spell out for you what are the reports that they were going to require for you to follow, so you can get your time-limited certification for that class. More or less every one of these denied conditions I've dealt with, and for every one of these conditions, except for psychoses and epilepsy, we've gotten the M in their medical certification. I'll extend that. Loss of consciousness, that's a little bit difficult, but we've gotten M in their medicals. Even with drug disorder, drug abuse, or substance abuse, it's possible to get your medical, but you're going to have to follow the guidelines that are set up with a special issuance, either sent out from region or from the Oklahoma City. I've had anybody from heart transplant to any one of these conditions. Okay, can we go to the next slide? Any questions regarding these conditions and denial?
I have a few questions. Let's see. Just give me a second. I don't think so.
No questions?
Wait, hang on. I'm just trying to walk through this. We got a lot of questions in the queue for the end, but I don't see anything. Oh, I have one. Let's see. From Claire, what level of insomnia?
Insomnia?
Yeah, insomnia is disqualifying.
That falls under the category of sleep disorders, and we have a protocol for every one of these. So you would have to provide certain data from your physician. What is the underlying condition? You requiring medication? How it affects you in terms of your daily life, work, etc. So if you have significant insomnia, I would look to the regional for guidance. And more than likely, you would have to provide us with some information that probably would go under an AME assisted special issuance, depending how significant the insomnia was.
Okay.
Okay, so let's go to the next slide. So again, this is the process. I'm going to so for a second. So special issuance, it's a process that occurs at aerial medical certification. Usually it goes down to Oklahoma City. Try to keep it within region. But if you have a region that you developed one of those denial conditions, and you're usually a first class, and usually if it's the first time you're applying for special issuance, where the AME has to defer, you would usually go down to Oklahoma City. They would want a ruling on it and come up with a protocol of reports that you would have to provide to the Oklahoma City to get the special issuance. So after that, it usually would be through region, which is a lot easier. It's easier for the AME to work with the region with these certifications rather than Oklahoma City. But sometimes it's mandatory with a condition that's denied and deferred, you would have to go to Oklahoma City. So the medical is deferred. When the medical is deferred by the AME because of a condition, it's more or less it's consistent with a denied condition. But the paperwork is a lot easier and the course is a lot easier if we defer it. So we don't make the final decision for denial, but we let either region or Oklahoma City make the denial, and they'll come up with their list, their protocol for your condition of information that they're going to require now for you to get your medical certification on an ongoing basis. So that's essentially why an AME should make the determination for denial, because it makes it a little bit more difficult for the pilot to follow the process of special issuance. So I don't like using, I never use denial. When the aeromedical certification receives the referral, as I said, they issue the denial according to Part 67, whatever certification you're applying for, first, second, or third, and they make the recommendations what you're going to have to follow to get your medical. And usually, every subsequent medical, you're going to have to provide information to them, and usually the medical is time limited. So if you're under 40 and usually have a 5-year third class, they may say every year you're going to have to provide certain data. So you'd have to get your medical every 1 year, 2 years, et cetera, rather than every 5 years, and provide certain information. But there's all sorts of time limitations that the FAA can do with a particular certificate, depending upon your condition. Once the recommendations are received and approved, as I said, a time-limited medical certificate will be issued with certain recommendations that must be met before the expiration of the time-limited medical certificate. The Aeromedical Certification Division down in Oklahoma City relies on medical consultants from private practice. So they have cardiologists, oncologists, of all the specialties. They have their own group of consultants to provide feedback on your particular problem and come up with recommendations for the special issuance. Usually region really doesn't have specialists at their on hand, but most of the decisions through region are just following protocols given by Oklahoma City. Okay, can we go to the next slide? So CACI stands for conditions an AME can issue. So these aren't really denying, they essentially may not be denying conditions, but they may, according to Part 61.53, affect your ability to fly. So we need to get additional information about these conditions before we can issue. And we usually have a worksheet which we may give to the AME and which we have to follow. So if those worksheet criteria are met and you have one of these conditions, we can issue as an AME. Can you go to the next slide, please, Ben? So if you meet the worksheet criteria, in other words, you don't have any critical problems with that condition, you take certain you don't take certain medications with that condition, you're within certain treatment bounds for that condition, we can issue. And again, if you don't have that information readily available, we have 14 days to hold on to the medical for you to accumulate that information, come back to us, and if it meets the criteria of the worksheet, then we can issue and keep it out of region or Oklahoma City. Next slide, please. Are there any questions regarding special issuance or CACI?
Yeah, I have a couple here. Let's see. Let's see. Okay, from Jeffrey, if deferred, then issued a special issuance, do you have to say yes when asked on a future exams that you've ever been denied?
That's correct. Essentially, your medical was denied by the Aeromedical Certification Division, and recommendations were given to you to get a special issuance. So yes, you would have to say they were denied. For that condition, you would deny it.
Okay. Another question from Charles. If you get a special issuance due to a cardiac condition, parentheses, got a stent placed, will you have to get a special issuance every year, or does one day revert it back to normal, say, class 3 certificate?
Well, usually when you get a special issuance, the region or Oklahoma City will come up with specific protocol for you that you're going to have to report, produce certain documents, maybe a stress test, maybe an ultrasound, maybe a cardiac cath. It depends upon the severity of your disease. With that time limitation before you can get a renewal of your certification. So whether it be first, second, or third, that's going to be time limited depending upon the documentation that you provide. So the certificate may say first class, and say that it's good for a year, and after that, it's not good for any medical after that until you produce those documents that are required by the region or Oklahoma City. So there's a time limitation no matter what you get with a special issuance, with instructions of what you're going to need to renew that time limited certification.
Okay. Excuse me, from Eric. Is coronary artery disease an automatic denial / special issuance? I have been diagnosed with CAD, but it is not severe and did not require any treatment or correction. No stent needed, no angina, etc. Right. That's the question.
Yeah, this is a good question, because this opens up the problems in terms of, well, not so much of a problem, but we have better diagnostic tests now for coronary artery disease. The calcium scans, the MRI arteriograms, which can diagnose coronary artery disease, and you may not even have known you've had it. So this is a condition where you have asymptomatic coronary artery disease. So you may see on these calcium scans, you may see a 30% occlusion, clearly diagnostic of coronary artery disease, but you may be asymptomatic. So the fact that you have coronary artery disease that's asymptomatic, I would pass you, okay? And clearly that's what the regulations say. It would have to be asymptomatic coronary artery. To be denied, it would be symptomatic coronary artery disease. I'm not sure if the FAA Aeromedical is looking at this in more detail, but the way it's written right now, it would have to be for denial for coronary artery disease is symptomatic coronary artery disease. So somebody with a 20% occlusion on a scan has a diagnosis of coronary artery disease, no symptoms, that would not fall into the category of denial. However, okay, there may be some issues that they may want a stress test. I may pass it, but the FAA has 60 days, whether region or Oklahoma City has 60 days, they may still want a stress test and statement from a cardiologist say asymptomatic. But I haven't run into that problem as of yet, but it's possible that could happen, and they could possibly put a time limitation on that. But if you were clinically free of disease, no symptoms, I would probably pass and see how the region handles it, or Oklahoma City, and go from there.
Okay, one more. I have a first class, but I am not flying due to a diagnosis of diabetes. I want to apply for a special issuance for third class now, and eventually for a second. Appreciate any advice. This is from Craig.
And does he have a diagnosis of diabetes, did he say?
I have a first class, but I'm not flying due to a diagnosis of diabetes.
Well, I'm not sure why you're not flying. You can apply for a special issuance, and most 99.9% of diabetics type 2 in the past have gotten their medical, whether it be a first, second, or third class, if you follow the recommendations of that special issuance. So you would be initially denied for having diabetes, and then you would be issued some recommendations to get a special issuance with a time limitation, your certification. But there's no reason why, if your diabetes is well controlled, type 2, you shouldn't be able to get a first class. Again, the new amendment that came in for insulin diabetes that came in, I haven't seen any insulin-dependent diabetic as of yet, so I don't know how that's going to affect you at this point. But if you're type 2, there's no reason why you can't get your medical.
All right, I think that's the end of these, but I have one question if you want to go back from before, rather than wait to the end. You want to do it or no?
Sure.
Okay, so this is from Maurice. It was regarding the person with conflicting vision results.
Yes.
Could the private eye specialist use, sign, and have applicants submit FAA Form 8500-7 to the AME? Could that be
yes, I think that would be appropriate. You can submit that form if it's the ophthalmological examination form, and that would be valid. But again, the region or Oklahoma City would want to know would probably want to know why there's a discrepancy. But if you have a legitimate documentation from the specialist, I think that it would carry quite a bit of weight, and that would be worthy of passing if you're within the eye guidelines for that particular class.
Okay. Yep, I think we're good for now. We can continue.
Okay, so can we go to the next slide, please? Okay, so basically, you really want to, an AME really wants to try to keep the control of your certification with the AME, because the AME can work very well with the AME to, as a team, try to get all the information together to get that certification for special issuance. So much so that the FAA does allow the AME to grant continued special issuance to for certain conditions, so it'll make the process easier for the AME. So usually catch a condition that doesn't meet the worksheet criteria, or a medical condition that any condition that again either goes beyond catchy criteria, that medications that may affect the ability to fly. These are deferred initially to the usually to region, and they'll come up with some recommendations for a special issuance, and they'll feel that they usually feel that it's a problem that as long as those conditions are met on continued certification, the AME can make the decision to continue the certification process. So they may say special issuance for a particular condition, all you have to do is provide a certain piece of information on your next medical, and any continued medicals, even though it's time limited, as long as it meets our guidelines, the AME can issue at that point, rather than sending the medical back to region and let them look at the data. So if the data falls in line with the recommendation from the initial deferral from region or Oklahoma City, the AME can issue with some form of time limitation. Again, there are certain conditions, more or less certain types of cancers, thyroid disease, heart conditions, atrial fibrillation is one. So they may go beyond the CACHI certification where go beyond the criteria that are in the CACHI worksheets. So they would initially have to go to region usually. They'd come up with recommendations. After those recommendations are initially met on any ongoing medical, it's in the hands of the AME rather than a region or Oklahoma City. Can we go to the next slide, please? Okay. As I said, a statement of demonstrated ability is usually dealing with a fixed defect, whether it's a loss of eye, partial amputated limb, hearing problems that are fixed. So with these fixed defects, you would initially apply, it would be denied by the region or Oklahoma City. They would either state that you're able to apply for a SOTA, or you can at the same time petition for a SOTA. And once you get the SOTA, there's no time limitation on a SOTA. So once you have it, it's good that you never have to reapply for that condition. In the past, we've had people who've had defective color vision, and they were issued a SOTA. So every time they come in for their examination, all they have to do is produce their SOTA certificate, and there's no further documentation that has to be sent to region Oklahoma City, and the medical would be issued by the AME. Once they pass a flight, if the condition requires a flight test to get their SOTA, once they pass that flight test, again, the SOTA issued once, they don't have to go for ongoing flight tests unless there's some progression of that fixed defect. Then you would probably have to reapply for the SOTA. Can we go to the next slide? Are there any questions regarding SOTA?
What I was going to suggest, can you hear me?
Yes.
Yes, what I was going to suggest, we have a lot of questions that keep coming through, and I have a ton in the queue. Maybe we should hold these to the end so we get through it, because we have until 11 o'clock.
Okay, great. Well, let's keep going.
And we'll do it that way. We can go a little over, but I don't want to have your presentation cut short.
Okay, Ben, can we go to the next slide? So this is an important point of what to look for in an AME. I've seen a lot of airmen who come in and they would just really cut short by their AME with a particular problem, given very little guidance, or essentially hand-holding and working as a team to get their certification. A lot of these problems can be handled through region. It's very important that the AME has a good working relationship with region. I'm in the New York region. They're an excellent team. I work with the doctors there, and I work with the office workers who are really spectacular. They really know the regulations very well, and they're very helpful in terms of helping me to help the airmen get the data, what they're going to need. And a lot of the times, particularly even with anything from special issuance, airmen special issuance, to CACHIs, we try to work with a region to get the airmen going as quickly as possible with the information that they're going to have to get. So the region is very, very helpful. So it's really very important that AME has a good working relationship with region. As I said, New York region is excellent. They're very available. The team is great there, and it's very important. Experience is important in terms of the AME, because you really want a good feel for what condition goes where and how you can tell the help the admin get the information that they're going to need, or give them a heads up that a particular condition would be either denying something that's worthy of denial or deferral, or a catchy condition. So a lot of this dialogue can go sometimes before the admin comes in for the examination. So somebody with experience will know certain conditions and help the admin out significantly. As I said, a good working relationship with the region is very important. Being a pilot helps because you know exactly where the admin is coming from. You're in the same position as him. As a pilot, I have to go for my medical certification every 2 years, and at the same time, I get a little nervous at times also. So I know where the pilot is at. So it's important that the pilot understand, that the AME understands where the pilot is coming from, and we can relate to their given situation. Can we go to the next slide? Don, you want to hold any questions for the end on this, or you want to keep moving? All right, so why don't we keep moving, Ben? Okay, so Basic Med, as you know, was implemented in 2007. Interestingly, that some of the statistics on Basic Med, well, we'll get to in a second. Let's just go through this slide in terms of it allows you to bypass Part 67, and it's actually an operational. Don, can you hear me?
Yeah, we hear you.
Yeah, I can hear you.
Okay, so it allows us to bypass the AME to bypass Part 67, and it's actually an operational reg, Part 68, where the airman can fly without going through the medical certification process. But they have to have a driver's license, and they must have had a medical certification issued after 2016. I'm sorry, 2006. So you have to have some type, even though it expired, if you had a special issuance or a third class, first class after 2006, and even though it was expired, you can apply for Basic Med as long as you have a valid driver's license. Now, if that special issuance was denied during that time, or your medical certification was suspended or revoked by the FAA, that's not valid. Then you would have to apply for a regular medical certification. So to apply for Basic Med. Can we go back to that slide, please? So under Basic Med, you can only fly an aircraft with 6 seats, 6,000 pounds or less, up to an altitude of 18,000 feet, less than 250 knots, and not for hire. So those are the limitations of Basic Med. There are certain conditions that, as I mentioned before, that you would have to apply through the regular Part 67 pathway and get a special issuance first before you get your medical Basic Med. And again, those are any psychological problem or substance abuse problem, any neurological problem, or any cardiovascular problem. So you'd have to apply through Part 67 to get your special issuance. Once you get that, any subsequent medicals, you can go through Basic Med. Can we go to the next slide? So the data. Some of the problems with Basic Med, since it's an operational federal regulation, it really bypasses the Part 67, the Aeromedical Certification Division. So there's problems where there's people are getting their medicals that may have been suspended or revoked, and the doctor who's doing the basic med exam is not aware of any of these problems because the airman may not be telling him about the problem. At the same time, the airman is required to remember, he's required to get the examination every 2 years, and he's required to get the answer questions and do the medical medical questionnaire every I'm sorry, he's required to get the examination every 2 years and the medical every 5 years. So on the medical questionnaire, it does at the end of the questionnaire ask whether there are certain conditions that may have an effect on his ability to fly. But if the airman doesn't answer them correctly, the certification, that questionnaire goes to the FAA, but it goes to a different division than the aeromedical certification. It really goes to the flight standards division rather than aeromedical certification. So there's a problem where there's there's a problem of communication between the flight standards and the medical certification. So flight standards may see a perfectly normal questionnaire, but at the same time, the pilot, when he was going through Part 67, had conditions that could have been deniable. So there's a problem of communication. At the same time, what do we do with conditions? Some of these problems, the driver databases are research for each particular basic med, but at the same time, somebody with a driving infraction can easily get by if there's no communication with aeromedical certification and the operations division. So there are certain problems, logistical problems, that are not being resolved at the present time. Can we go to the next slide, please? Do you want to hit some questions regarding basic med at this particular point, Don?
Okay, I have to see what's here because I don't necessarily have them by category, but I'll.
Okay, so why don't we keep going then? And we'll come up with some, there's some, can we go back one slide for some of the data on basic med? Okay, so just like some additional points on basic med. There's approximately 50,000, at the present time, there's approximately 50,000 airmen who are using basic med. And of those 50,000, they're mostly third-class airmen. I'm just want to get some of the statistics on that. So about 50,000 basic med airmen, which really affected the third-class medicals more so than any other medical. So right now, there's 50,000, which came from the pool of third-class medicals, which really originally, I think the pool of third class were greater than 200,000. And with the implementation of basic med, it's dropped by about 50,000, which has gone to a basic med category. Some of the other statistics in the basic med is again, most of them are third-class airmen. The highest certificate held on the basic med, most of the certifications of the basic med are private pilot, followed by, and that's about 30,000 of the 50,000, Commercial pilot, about 9,000. ATPs, about 4,000. By the way, all this data is in your handouts. You can see in the I gave you a copy of the Federal Air Surgeon Medical Bulletin. The average age of the basic medical pilot is 65. Can we go to the next slide, please? Okay, we'll pass this and go to the end for the questions. Okay, so marijuana, we touched upon this in our some of the questions initially. Obviously, THC is the active ingredient in marijuana. It's approved for recreational and medical use in many states, but again, the federal legislation is what matters here, because federal legislation oversees the FAA, and clearly, whether a state allows medical as well as recreational medical marijuana, it's still you still cannot fly within that state because the medical certification goes through the federal branches. We mentioned CBD oil. There's no effects on similar to THC, but again, at this point in time, there can be contamination of that particular product with the THC, so the FAA does not allow that particular product if you're flying. There is a drug, Epidiolex, which is used for seizures. Whether you're using that product or have a seizure disorder, it's really academic, because either condition, either using the drug or having a seizure disorder will negate your medical. There's different grades of CBD oil, which is the Epidiolex. That's a pharmaceutical grade of CBD, again, that's not allowed if you want to fly. The non-commercial, the CBD in Epidiolex is a pharmaceutical grade. And even with a pharmaceutical grade, you cannot fly with that product, as well as having a seizure problem. The commercial grade, again, can be contaminated with THC, which is what you get in the store, and clearly you cannot fly with that, as I mentioned before. Medical marijuana prescriptions and medical marijuana is not allowed by the FAA. And as we know, there are acute and chronic effects of marijuana, long-term effects. From in the aviation sphere, this is a product that is not allowed for the obvious reasons of the acute and chronic effects. Can we go to the next slide? Over-the-counter medications, particularly the antihistamines, the first generation antihistamines are not, if you use these, they're not allowed if you're using them, because they do cross the blood-brain barrier, and they can cause impairment. So products such as Benadryl, Unison, Vistaril, chlortrimeton, they're not allowed. Whether you're using them prior to, obviously you cannot use them while you're flying. So even if you're using them prior to, you cannot fly. Okay, you will not be issued a medical certification unless you have to stop them for a certain period of time before we can issue. If you put that down on a certificate on your medical when you're on your 8500 form. The second and third generation non-sedating antihistamines, Claritin, Clarinex, Allegra, Zyrtec, and Zysol. They're less likely to cross blood-brain barrier, but the only ones that you can are allowed to fly with after initial trial period are Claritin, Clarinex, and Allegra. So you'd have to be on them and show prior to give us a history that you take them and you have no side effects, no adverse effects, and we would be able to issue if that was the case. Some of the antihistamines you can be certified by the examiner under certain conditions if you don't exercise the privileges of your certificate. If the medication was taken and you wait a certain period of time. So if the medication is dosing every 12 hours, you'd have to wait 5 times that 12 hours. That's the dosing interval. So you'd have to wait 60 hours for certain medication to fly, okay, on certain of these products. But usually the airman is usually taking, they know the, more or less know the products that they can take, Claritin, Clarinex, and Allegra. And as long as you're taking those and show no initial adverse effects, we'll be able to issue you the medical. Aging pilot. This is a pretty pertinent topic at this point in time with the aging population. And there's several studies, and there's numerous studies out there, and they're in your handout. AOPA has a publication that they've listed a lot of studies, and essentially there's a physiological age of a person and there's a functional age. So we have a lot of elder population pilots who may actually be very fit and not show their physio. So a 65-year-old may have the functional capacity of a 55-year-old. So there is a discrepancy there, or there is something that needs to be evaluated to see if the functional age and the physiological ages of the pilot match. So there can be, it can work to the advantage of the pilot and can work to the disadvantage of the pilot. But the point is, as we age, there's clearly a deterioration of our vision, of our hearing, of our coordination, as well as our higher cognitive functions. No question about it, all the studies have documented that. We see this in the driving population also, the age population that are come for certification for their DOT certification. So the DOT population as well as FAA population, there is an aging population that we're seeing, and we have to be aware that clearly, as all the studies have shown, that clearly as you age, there's a deterioration in your senses, in your and your cognitive function. However, one of the key studies that was documented in Neurology of February 2007, which was a fairly significant study, because after the study, the FAA raised the retirement age in commercial pilots from 60 to 65. And this study showed that essentially, even though the aged pilot performed less effectively than the younger pilot on certain testing parameters in a simulator. So they were, in this particular study, they tested over 100 pilots who were non-commercial, general aviation pilots with from certain ages from 40 to 69. The younger pilots performed better, okay, but over time, these people were tested over 3 years. Over time, the testing for certain key factors, which were, I think these are important to, let me just, give me 1 second here. The study looked at air traffic communications, traffic avoidance, scanning cockpit instruments, and executing approaches. So those particular tasks were tested over a 3-year period, and there's a summary score that was attained for each AME. So even though the older pilot performed initially less effectively, had a less summary score than the younger pilot, over time, the older pilots that were being tested, their summary scores seem to get better, and actually in some particular testing points were actually better than the younger pilot. So over time, experience does matter for the older pilot. So this, as an older pilot, this is an important point to walk away with, that in time, a particular task, okay, can be more effective if it's done repetitively. And also what was determined, the pilots with more advanced ratings, they also seem to have performed better in the long run than the older pilot that had less experience and less advanced ratings. So again, the walkaway point is we have a deterioration of our normal functioning of our vision and our hearing and our motor capabilities, as well as our cognitive functions. But with experience and more advanced ratings, the older pilot can successfully stay in the cockpit and flying at a particular capability. The older pilot with less experience and less advanced ratings is much more at a disadvantage than the pilot of equivalent age with those particular features. So this is the walkway with this particular point with the elder pilot. Commercial versus general aviation. Again, there's in commercial aviation, in terms of accidents, clearly there's a U-shaped curve with commercial aviation and accidents. So again, with that U-shaped curve, the pilots with more experience and more advanced ratings tend to be a little bit safer than actually commercial pilots with less experience and less advanced ratings. General aviation pilots, more or less, the data was from that neurology study, and you can see, as I said, the older pilots with the more experienced ratings and the more experience and the advanced ratings did better than the similar pilot of equivalent age.
All right, Dr. Panzer, I'm going to move on to our COVID-19 slide. I am going to put up a poll here we're just curious to know if you believe you're going to have difficulty now, or you're having difficulty for renewing your FAA medical due to the coronavirus crisis. So I've put the poll up on the screen for you, and this will also be our reminder to everybody that we have about 10 minutes left. I think we're basically on our last topic here, and then we'll open it up to some questions. And if for some reason we don't answer your questions during the seminar or webinar today, we will have them, and we can try to get you an answer via email. All right, we have about 72% voted right now, so I'll close the poll in 3, 2, 1. And I'll share that for everybody to see. So it looks like right now, people are not having difficulty with getting their medical renewed. Now it could be that we and I don't have the data on this, but do we do a lot of renewals, you know, in the non-flying months? So maybe people already are renewed, you know, in January and February, or they do it, you know, after the summer season. But I'm glad to see that. And Dr. Panzer, you wanted to explain what this photo was about on the screen here. Which give me a second. Show it again.
Okay, so this is we're in the present. We're faced with COVID-19, and this is really how we're practicing medicine at the present time. This is my medical assistant in my office, and we're seeing patients. We're doing we have a hold on our AME or on FAA medicals, but we're doing DOT exams. But this is the state of the art right now. COVID-19 is affecting us all. It's a problem. Can we have some questions regarding COVID-19, and we can review some of the other questions, Ben and Don?
Yeah, I have, well, we have a lot of questions. I don't know if we can get through them in 10 minutes. There's like almost 30 questions that we have on the panel, but I could just take them in order. What we didn't do, which I guess for next time it would, now I can see, there's really no way to segregate them by subject, but I could have done it by time. When you change to a new topic, I'd see a time, I'd be able to reflect back. But since I don't know what that is, I was just going to take them in order. Do you agree, or?
Whatever you feel comfortable doing, Don.
Okay. Ken or Rick or Ken have a suggestion?
Yeah, just start with the ones that I think they've put in as high priority, and we'll tackle as many as we can.
Oh, okay. So we have here from Douglas, this is way back, this was an hour ago. I'm in the process of obtaining a special interest issuance. My documentation was sent to Oklahoma City. Is there an additional delay because of the COVID-19 issue?
I would have to say yes to that. And Oklahoma City, to begin with, is always, this is not a negative Oklahoma City. They just have a tremendous workload down there. So they always, fact that they have a large workload in there, they're backed up. Okay, so going to Oklahoma City sometimes is a necessity in certain situations, but if at all possible, the AME, your AME, should, within his power, try to avoid Oklahoma City as much as possible. They would like it because it reduces their workload. You would like it because it's going to speed up the process. And so right now with this, God knows how COVID-19 is affecting them down there. It's going to be a delay. So if it's possible, if your AME could find out where you are in the deferral and special issuance process, he could possibly help request your region, his region, the AME's region, your region, to look into the process. And maybe if it's a particular problem, that region can issue the special issuance. They could possibly do that. This is a situation where a good relationship with a region could help you and pull that particular certification out and have it rest in the hands of a region. So I would touch base with the AME, see if he can pull it and go to region for the final disposition.
Okay, Arnie, your screen is off, just so you know.
Yeah, I know.
This is from Michael. If one eye fails to meet standard, what is the process for flying with one eye?
Okay, so if you had an outright failure or denial, you can apply to essentially the federal air surgeon, but I would go to region. I would contact your region and see what the process is for applying for a SOTA, statement of demonstrated ability, if the eye problem is of a permanent fixed defect. If it's an ongoing problem, a medical problem, where the vision is going to continue to deteriorate, or it's going to affect the other eye, then you're going to have to apply for a special issuance.
Okay, from Calvin. What about developing cataract in one eye? Can only correct to 2025. Other eye is fine, correctable to 2020 with prescription lenses.
Well, if you pass the visual test, it's fine. I mean, if you pass vision test, whether you have a cataract or not, you're fine. Pass the visual requirements. So if you look at the elderly population, even though there are a lot of people walking around, a lot of elderly people walking around with early cataracts, still passing the visual test and not knowing they have cataracts. So if you have early cataracts and passing the vision, there's no reason why you can't get your certification.
Okay, good, thank you. From Thomas, have you ever taken a cog screen test? If so, your thoughts as it applies to the older pilot in general aviation?
I myself have never taken one, but you know, they're valid tests. Depending upon where you fall, if you have taken the test, it's something you should seriously look at and how it affects your ability to fly. Cognition deteriorates as we get older. Our other senses deteriorate. Our other abilities deteriorate. Clearly, we are a product of the aging process. So you have to integrate what your particular position is and how you fly, and have your own approach to how you can approach flying, considering your results.
Okay, from Mark, does 61.53 pertain to colds, flu, and febrile illnesses?
So it applies to any medical condition. I mean, if you get a cold and you can't get out of bed, and you're running a fever, and you can't, how can you possibly? Yes, it would be you would be considered temporarily disqualified to fly a plane. So it would not be something. It would be a short-term disqualification, and you would not be able to fly. You get better, you're able to fly. You've grounded yourself. We see a lot of conditions where airmen know that they have a condition that's temporary, no long-term effects, and they can go back to fly. If there's questions, they'll call. This particular question that I gave you before about the lidocaine injection to the back, that's a condition where you really have to think about it. I mean, you're better in the next day after the injections, but you have a long-term problem with the back. That's something that the FAA would really want to know about, aeromedical certification. So there's different degrees of temporarily disqualifying, and that you have to use a judgment or ask your AME.
Right, okay. As it pertains to, this from Scott, as it pertains to treated sleep apnea, treated and controlled, and type 2 diabetes, also treated and controlled, is there a difference between third class and second class medical?
No, you should be able to get your second class with both conditions under the special assurance procedure.
Okay, good. Whoops. All right, 1 second. Okay, from Wilbur, my endocrinologist suggests Involcatin SGLT2, which FAA does not like. Is it allowed with basic med?
Again, I'm not quite sure what you're being treated for, but your doctor is required to determine whether you have a condition that may affect your ability to fly. You're still subject to 61.53, but your private doctor may not know that particular regulation, but yes, it could. If it affects your ability to fly, you shouldn't be flying.
Okay.
And you would possibly not be able to get a basic med pass if your doctor seems that it would affect your ability to fly.
Okay.
All right. Sorry, Don, I got to interrupt. Yeah, you had me check. There is another webinar that is scheduled to start right now out in Denver. So they're using the system. So we're going to have to end now. I think you had explained that you might have a Zoom availability.
Yeah, just all I want to do is I want to thank everybody for today and taking the time and coming to our seminars. Second Saturday of every month, we'll do another one in May, second Saturday. If anyone has a question and they don't have time to hang around any longer, just email don@midislandair.com and we'll do our best to try to get your answers. If anyone does have a time, I don't, it's probably limited to how many people we can do it. I've set up a Zoom meeting right after this. If you email me at don@midislandair.com and just give me an idea what's your question or what you want to put in it, I'll send you a link so you can get in. We can actually talk among ourselves. So
yeah, I could probably hang around for a half hour or so too for these questions, since there's so many.
Okay. So if anybody wants to do it, email don@midislandair.com and I will send you a link. And again, thank you everybody for showing today. Have a good day. Stay safe. And look at our website or our Facebook page and website for information on what we're doing and lessons and flights and whenever that breaks open. Okay. Thanks everybody.
Thanks everybody.